All right, so today we're taking a deep dive into some respiratory therapy study material.
That's good.
Looks like you're prepping for the respiratory therapist multiple choice exam.
Yeah, that's right.
Big one. Administered by the NBRC.
That's the one.
We've got this Kettering National Seminars study guide here.
It's a good one.
And, oh, it's fantastic. It's got a pretest. It's got an answer key to the pretest,
Yep.
content analysis breakdown, like how much of the exam is going to be on this topic or that topic.
Right.
And then it really dives deep into patient assessment, which is great.
Yeah, it's really key for the test.
So we're going to hit the highlights of this.
Okay.
We're going to uncover some surprising facts,
Okay.
and hopefully you can walk away from this deep dive feeling confident and ready to ace this exam.
Sounds good.
So this Kettering study guide,
Yeah,
it's designed to mirror the structure of the actual exam,
it is.
which is very helpful.
Yeah, so it goes through all the different sections that'll be on there.
Like patient assessment,
Yeah.
airway care,
Yep.
all the therapeutic procedures, all
Okay.
that good stuff.
All the things you need to know.
And the pretest, I love this because it lets you assess your strengths and weaknesses across all those different categories.
Exactly. Going into it, you might think, oh, I know this topic really well.
Right.
But then you take the pretest and you're like, oh, maybe not so much.
Yeah, exactly. And maybe there are some areas where you're like, oh, I actually know this better than I thought I did.
Yeah, for sure.
And I love that they include a content analysis form.
Yeah.
So as you're going through and studying, you can actually track your progress and identify areas where you might need to focus a little more.
Right. So you're not just kind of blindly studying everything.
Right.
You can really hone in on what you need to work on.
Yeah, exactly. No more wasted study time.
Exactly.
Now, one thing that really jumps out at me
Yeah.
in this study guide is the emphasis on the 4 critical life functions.
Yes. Ventilation, oxygenation, circulation, and perfusion. The foundation of respiratory therapy.
Absolutely. And you can't overstate how important those are.
No, you can't.
It's like the mantra
Right.
for respiratory therapists.
Like you have to know those inside and out.
Totally.
The back of your hand.
And the way they connect them to specific examples in the pretest is brilliant.
Uh-huh. It really helps you apply the knowledge.
Like there's this case with an elevated BNP level.
Oh, yeah.
And so you see that, and immediately you're thinking congestive heart failure.
Right.
And then you're thinking circulation and perfusion.
It's all connected.
All tied together.
It's like a puzzle.
Totally.
You got to put the pieces together.
Like a detective game almost.
Exactly.
You're piecing together these clues to figure out what's going on with the patient.
And speaking of clues, did you see that Swan-Ganz catheter example?
Oh, yeah.
Who knew something as simple as a dichrotic notch could tell you so much?
I know, right?
I mean,
You're not just sticking a catheter in blindly.
What?
You're confirming you're in the right spot, which is the pulmonary artery.
Yes.
So you can get those pressure readings.
It's all about precision.
Right, and then precision.
There's that tension pneumothorax scenario.
Oh, yeah, the one with tracheal shift.
Yes, and diminished breath sounds.
Classic signs.
You see that combination?
Uh-huh.
You know you've got a serious ventilation problem,
Big time.
and you need to act fast.
Right away.
And it's amazing how these seemingly small details
Right.
can make such a huge difference in a patient's outcome.
It's true.
It really highlights the importance of thorough and rapid assessment.
Absolutely. You got to be quick, but you can't miss anything.
Exactly. You need to be able to connect the dots,
Yeah.
recognize those red flags, and know how to respond quickly and appropriately.
And this study guide really lays that all out for you.
It does.
Takes you through taking a patient history, performing a physical exam, even interpreting those tricky radiographic images.
Don't you love that they included illustrations?
Yeah, those are really helpful.
Especially for visual learners like me. For sure, they really bring those concepts to life.
It really helps solidify those complex concepts.
Absolutely.
But let's not forget about the other key skills
Right.
you'll need for the exam and in your career.
Like what kind of stuff?
We're talking about managing different equipment
Uh-huh.
and therapeutic procedures.
So like the hands-on stuff.
Exactly.
Okay.
So from administering IPPB therapy
Right.
to troubleshooting a bubbling humidifier
Yep.
to managing a patient with a pneumothorax,
It's a lot to cover.
there's a lot to cover.
Yeah.
It's not just about memorizing the steps.
No.
It's about understanding the why behind each procedure.
Exactly. Why do we use a specific oxygen flow rate for carbon monoxide poisoning?
Right.
It all comes down to the science.
Like, why is that?
Well, think about it. Carbon monoxide binds to hemoglobin
Uh-huh.
with a much higher affinity than oxygen.
Right.
So it's essentially starving the body of oxygen.
So it's like the oxygen can't even get a seat at the table.
Exactly.
And that's where high flow oxygen comes in
Like a superhero.
to save the day.
It swoops in and displaces that carbon monoxide,
Yes.
restores oxygen delivery to the tissues.
I love that analogy.
It's a good one, right?
It makes it so clear.
It makes it easy to understand.
And then there are those calculations.
Oh, yeah, don't forget about those.
They might seem daunting,
They can be.
but they're crucial.
Absolutely, both for the exam and for real-world practice.
Oh, absolutely. Imagine having to calculate systemic vascular resistance.
Or estimate shunt fraction.
On the fly.
Gotta be sharp.
You really do.
Think of those calculations as the language of respiratory therapy.
Okay, I like that.
They provide objective data points
Uh-huh.
that help you assess the patient's condition,
Okay.
track their progress,
Right.
and make informed decisions.
That makes sense.
It's all connected.
Yeah, so you can't just gloss over those.
No, definitely not.
And you know what else I appreciate about this study guide?
What's that?
It doesn't just focus on the clinical stuff. It also gives you the tools to ace the exam itself,
Oh, that's important.
like test-taking skills
Uh-huh.
and strategies.
Okay.
That's so valuable.
Like what kind of stuff?
I'm talking time management,
Mhm.
reading each question carefully,
Yeah.
using the process of elimination.
Those are game changers.
They really are.
For sure.
And that tip about managing test anxiety by practicing test-taking under pressure.
Oh, that's a good one.
Brilliant.
Because you know when you're in that testing environment,
Right.
you get nervous
Yeah,
and you don't always think as clearly.
exactly.
So practicing beforehand can really help.
The more you practice, the more comfortable and confident you'll become.
Yeah, practice makes perfect.
It's like anything else in life.
Exactly.
But before we move on to
Yeah.
part 2 of this deep dive,
Okay,
there are a few more nuggets of wisdom I want to pull out from the Kettering Guide.
sounds good. Let's hear them.
Okay, so let's revisit that tension pneumothorax case for a second.
Okay, the one with the tracheal deviation. Yeah.
I love how the study guide emphasizes
Huh?
that this is a life-threatening condition
Oh, yeah.
where air gets trapped in the pleural space.
Right.
It compresses the lung and
Yeah.
pushes the trachea right out of place.
Yeah, that tracheal deviation is a big clue.
You can't miss that.
No, you can't.
It's like it's screaming.
It's serious.
This is serious.
We need to intervene now.
We need to intervene now.
Exactly.
Needle decompression followed by a chest tube.
Yes, those are your life-saving measures.
They really are.
You got to know those.
So it's all about recognizing the severity of the situation and acting decisively.
Absolutely.
Now, shifting gears a bit,
Okay.
let's talk about oxygen administration,
Right.
specifically for carbon monoxide poisoning.
Okay.
This study guide really hammers home the importance of those specific oxygen flow rates.
Yeah. Why do you think that's so critical in carbon monoxide poisoning?
Well, as we mentioned earlier, carbon monoxide binds to hemoglobin way more strongly than oxygen. So it's like the oxygen can't even get a seat at the table.
Exactly.
And that's where high-flow oxygen swoops in
There's a rescue.
to save the day.
It's like a flood of oxygen molecules pushing that carbon monoxide out and restoring order.
I love that analogy.
It's a good one, right?
It really paints a clear picture.
It does.
Speaking of clear, I'm fascinated by that troubleshooting scenario with the bubbling humidifier.
Oh, yeah. That one's tricky.
You hear that whistling sound,
Uh-huh.
and you know something's not right.
Right away.
But why is that?
Well, if we think about the bigger picture,
Okay.
that whistling is a clue that something is blocking the flow.
Interesting.
It's a reminder to pay attention to the detail.
Right.
Even something as seemingly minor as a whistling sound.
Because it could be a clogged oxygen tube,
Exactly.
and that could have serious consequences for the patient.
Absolutely.
So it's all about being observant, connecting the dots,
Yeah.
and thinking critically.
That makes respiratory therapy so interesting.
Okay, one last example before we move on to part 2.
Okay, hit me.
What about that case with the patient on IPPB therapy?
Oh, yeah, the one where the peak inspiratory pressure isn't reaching the set value?
Yes, exactly.
What's going on there?
Well, there are a few possibilities, right?
Yeah.
Could be a leak in the circuit,
Uh-huh.
a kink in the tubing,
Could be.
but it could also be something more complex,
Like what?
like bronchospasm,
Okay.
mucus plugging things up,
Mm.
or even the patient not taking a deep enough breath.
It's like a puzzle.
It is.
You got to figure out what's causing the problem.
And you've got to use all the pieces to figure out the solution.
Exactly.
The patient's history, your assessment findings, the behavior of the equipment,
It all comes into play.
it all matters.
And that's what makes respiratory therapy so challenging and rewarding.
It really is.
You're not just following a recipe.
Right.
You're using your knowledge and critical thinking skills to provide the best possible care for your patients.
And that brings us to the end of part 1 of our deep dive.
Wow, that was a lot of information,
It was.
but it was good stuff.
It was good stuff.
I feel like I learned a lot.
Me too. And we've got even more exciting cases and concepts to explore in part 2.
Can't wait.
So stay tuned.
We'll be right back. Okay, so you ready for round 2?
Let's do it.
All right, I got another Kettering case study that's really got me thinking.
Okay.
Imagine you're dealing with an obese patient who's struggling to breathe.
Mm-hmm.
What's the best position to help them?
Ooh, that's a good one.
Yeah.
I remember this from the study guide.
Okay.
It's all about understanding how body mechanics impact breathing, right?
Exactly. You need to know how to position the patient to optimize their lung function.
Right.
So in this case,
Uh-huh.
the lateral Fowler's position is the winner.
Now remind me why that position is so helpful.
Okay, so think about it. When someone is obese, the weight of their abdomen can put a lot of pressure on their diaphragm,
Right.
making it harder to breathe.
Mm.
But if you position them on their side,
Yeah.
slightly reclined, it takes some of that pressure off.
Okay.
Gives those lungs more room to expand.
So it's like a simple adjustment, but it can make a world of difference for the patient.
Exactly, for their comfort and their breathing.
It's amazing how much we can achieve just by understanding a little bit of anatomy and physiology.
It really is. The body is a fascinating machine.
It is.
Speaking of anatomy and physiology,
Yes.
let's jump to that question about ECMO and newborns.
Okay.
Remember that one?
Yeah.
They give you a set of oxygenation index values
Uh-huh.
and ask you to pick the one that would indicate the need for ECMO.
Oh, yeah, that's where those calculations come in.
Exactly.
The oxygenation index helps us gauge how severe the respiratory failure is.
Right. A higher oxygenation index equals more severe disease.
So in this case, an index of 44,
That's a big red flag.
that baby needs ECMO.
That baby needs ECMO.
ECMO is like the ultimate life support for these tiny lungs.
It is.
It's basically a heart-lung bypass machine that gives their lungs a chance to rest and heal.
Exactly. It takes over the work of the lungs.
Talk about high stakes.
It is incredibly specialized and resource intensive.
Wow.
But this question highlights the importance of being able to interpret those critical values and recognizing when a patient needs that extra level of care.
It's all about connecting the dots and making those life-saving decisions.
I've got it.
Okay. Are you ready for a real brain teaser?
Get me?
This one involves a patient with a left-sided pneumothorax
Okay.
who's been treated with a chest tube.
All right.
The respiratory therapist notices continuous bubbling in the suction control bottle.
Ooh, that's a classic.
What's going on here?
Well, continuous bubbling in the suction control ball usually means
Okay.
there's an air leak
Right.
somewhere in the system.
But where's it coming from?
Right. That's the question.
The study guide throws out a few possibilities.
Like what?
Could it be a leak in the chest tube itself?
Okay.
Or maybe the pneumothorax is resolved and that's why we're seeing the bubbling.
Hmm.
Or could it be a problem with the vacuum regulator?
I'll give you a hint. Think about what continuous bubbling means.
Okay.
It means air is still escaping, right?
Right.
So what does that tell us about the pneumothorax?
I see where you're going with this. If air is still escaping, it means the pneumothorax hasn't fully resolved.
Exactly.
So the most likely culprit is a leak in the chest tube itself.
You got it. It's like a detective story.
It
You
is.
got to follow the clues to crack the case.
Now, I know some of these calculations can feel a bit intimidating.
Oh, yeah.
Like that one where we have to estimate the shunt fraction.
Shunt fraction can be a tough one.
It sounds so complex.
It can be. But I think I have a way to make it easier to understand.
Okay. All ears.
Think of it this way. Your lungs are like a busy airport, right?
Okay.
The goal is to get passengers, in
Uh,
this case oxygen,
okay.
onto planes,
All right.
the red blood cells.
Gotcha.
But sometimes there are delays,
Mm-hmm.
and some of those passengers end up bypassing the gates altogether.
Yeah. So the shunt fraction is like the percentage of passengers who miss their flights.
Exactly. It represents the portion of blood that flows through the lungs without picking up oxygen.
Okay, that makes sense.
So a higher shunt fraction means less oxygen is getting to the body.
Which can be a big problem.
The very big problem.
So conditions like atelectasis, pneumonia, pulmonary edema,
Yeah.
those can all lead to an increased shunt fraction.
They can because they create obstacles in the lungs, making it harder for the blood to pick up oxygen.
It's like those passengers are running into roadblocks at the airport
Exactly. They can't get to their gates.
and they miss their flights.
And the body doesn't get the oxygen it needs.
It all comes back to the relationship between ventilation and perfusion.
It does. If those two things are out of sync, you're going to have problems with gas exchange.
It's amazing how much we can learn just by thinking about the lungs as a busy airport.
It's a helpful analogy, right?
It really is.
Now let's talk about ventilator graphics. I remember that case in the study guide where we see those sharp, pointy peaks at the end of inspiration on the airway pressure waveform.
Oh yeah, what's that all about?
That's a classic sign of insufficient expiratory time.
Insufficient expiratory time.
Imagine you're trying to squeeze all your belongings into a suitcase that's too small.
Uh-huh.
You keep pushing and pushing,
Yeah.
but you can't get it all in.
So in this case, the lungs are like the suitcase and the air is like your belongings?
Exactly. The
Mhm.
patient isn't getting enough time to exhale fully before the next breath is delivered.
Okay.
It's like they're constantly trying to cram more air into a space that's already full.
And the study guide mentions that this can be caused by a few different things,
Yeah, like what?
like a high respiratory rate, a large tidal volume,
Okay.
or increased airway resistance.
It's important to recognize this pattern
Right.
because it can lead to air trapping
Yeah.
and all sorts of complications.
So you need to be able to adjust the ventilator settings
Right.
to give those lungs a chance to empty properly.
Give them a break.
Speaking of ventilator settings,
Yes.
the Kettering Guide does a great job of breaking down the initial settings
Uh,
for both adults and infants.
It does talk about a high-pressure situation.
I know you need to get those settings right from the start.
Absolutely. And the guide gives you all the formulas and guidelines you need
How good did?
to calculate the appropriate tidal volume,
Uh-huh.
respiratory rate,
Yeah.
FiO2, and PEEP.
Wow. It's like they thought of everything.
They really, did they even take into account factors like the patient's weight,
Okay.
their lung condition,
Mm-hmm.
and their blood gas values?
It's like a recipe for success.
It is,
Mm.
but you still need to use your clinical judgment
Right.
and adjust those settings based on how the patient responds,
That makes sense.
because every patient is different.
They are.
And I love how the study guide uses real-world case studies
Me too.
to bring all of this to life.
It makes it feel less like you're just memorizing facts and more like you're actually learning how to think like a respiratory therapist.
Exact. That's the goal, right?
It is.
You know, one of the things that really impressed me about this Kettering study guide
What's that?
is the emphasis on critical thinking.
Uh-huh.
It's not just about spitting back facts.
Right.
It's about being able to analyze situations,
Yeah.
solve problems,
Mm.
and make sound decisions.
It's like they're preparing you to be a true clinician.
Exactly. Not just someone who can pass an exam.
Right. They're giving you the tools to become a skilled and compassionate respiratory therapist.
Who can make a real difference in your patients' lives.
And on that inspiring note,
Yes.
we're going to wrap up part 2 of our deep dive.
Already.
But don't worry, we're not done yet.
Oh, good.
We've still got more to explore in part 3.
Can't wait.
So stay tuned. Welcome back for the final part of our deep dive into this Kettering study guide.
I'm ready.
I'm really struck by how much there is to learn in respiratory therapy.
What's up?
It's so much more than just operating a ventilator.
Oh, for sure.
You really have to understand each patient's unique situation
Mm-hmm.
and tailor your care to their specific needs.
Absolutely.
It's really a complex field,
It is.
and it's constantly evolving.
Yeah.
But this Kettering Guide does a fantastic job of keeping you up to date
It does.
on all the latest best practices.
Definitely.
One area that I found really interesting
Yeah.
was the section on different modes of ventilation.
Oh, yeah, that's a big one.
Got a whole buffet of options.
There's assist control, SIMV, pressure support CPAP.
So many choices.
How do you even choose?
Right.
Well, that's the key, isn't it?
It is.
Understanding not just what each mode is,
Uh-huh.
but when to use it.
Right.
You need to know how those modes impact the patient's breathing their gas exchange, the overall mechanics of their respiratory system.
So it's like choosing the right tool for the job.
Exactly.
You wouldn't use a hammer to screw in a light bulb.
No, you wouldn't.
You need the right ventilator mode.
Right.
To match the patient's needs.
And the study guide does a great job
Yeah.
of walking you through
Mm.
the pros and cons of each mode
Right.
to help you make those decisions.
And speaking of critical decisions,
Yeah.
what about airway management?
Oh, yeah. That's another area where things can get intense quickly.
You're talking about those moments when you need to secure an airway, whether it's with basic techniques like head tilt chin lift or more advanced procedures like intubation.
Talk about pressure.
I know, right?
You need to be prepared for anything.
For sure.
What if the patient starts to laryngospasm during intubation?
Oh, gosh.
Do you know what to do?
Well, thankfully, this Kettering Guide
Yeah.
lays it all out.
It does.
Prevention strategies,
Hmm.
treatment options.
It's all there?
It's like having a cheat sheet for those high-pressure situations.
It is.
It can really help you stay calm, focused, and ready to act.
Absolutely.
We've talked a lot about the clinical knowledge covered in this study guide,
We
but I want to circle back
Okay.
to those test-taking strategies
Oh, yeah, those are important.
because they're just as important for success on exam day.
They are. You can know all the ins and outs of respiratory therapy,
Right.
but if you don't know how to approach the exam itself,
Yeah,
it's all for nothing.
it's true.
So time management, reading those questions carefully, using the process of elimination,
Mm-hmm.
those are your secret weapons.
And don't forget about managing those pre-test jitters.
Oh, yeah, those are real.
The study guide has some great tips
It does.
on relaxation techniques and visualization.
That can really help.
I'm a big believer in the power of positive thinking.
Me too.
It's amazing how much of a difference those mental game strategies can make.
It really is.
It's all about going into that exam feeling confident and prepared.
Absolutely.
So I think it's safe to say that we've thoroughly explored this Kettering study guide.
I think so. We've covered a lot of ground.
We've covered everything from patient assessment to key concepts and skills to test-taking strategies.
It's a great resource.
And I feel like we've barely scratched the surface.
There's so much information packed into this guide.
It's a treasure trove of knowledge.
It is, and the authors are clearly experts in their field.
And incredibly skilled educators.
They've made learning about respiratory therapy fun and engaging.
But as amazing as this study guide is, it's important to remember it's just one piece of the puzzle.
Right.
True success in respiratory therapy comes from dedication, critical thinking, and a genuine passion for this incredible field.
Couldn't have said it better myself.
So as we wrap up this final part of our deep dive, I want to leave you with a final thought.
Okay.
Remember those 4 critical life functions we talked about?
Ventilation, oxygenation, circulation, and perfusion.
How can you use those as a framework for understanding and managing the wide range of respiratory conditions you'll encounter in your career?
That's a great question to keep in mind as you continue your studies.
Absolutely. And as you prepare for your exam,
We're cheering you on every step of the way.
you've got this.
Best of luck.
And we'll see you on the next deep dive.